Do you think that there are some doctors out there who prioritize profits over the well-being of their patients? Will it make it fishy down there? Putting fish DNA into their penis filler. How much longer can it get? Just stop me. Dr. Seo, it's a bit too big now.
That is really time to ditch the glass skin trend.
The Korean glass skin.
That's not natural. Rubbing papaya milk will make your breasts go bigger.
If you like my face, I have got to thank my parents and now Dr. Seo, who is an aesthetic doctor, my aesthetic doctor, and has been in this field for quite some time. But I'd like to find out, what is the strangest request that you've ever gotten?
Well, I get pretty strange requests from time to time, but I think the one that really stuck with me was this lady who came, and this was before the days of AI. She came and then she showed me a picture on her phone. And it was obviously computer generated. And she told me, I want to look like that. And this is how I used to look like.
No way.
And I looked at it and I said, no, I don't think this is you. And she said, yes, it is. So she obviously generated a computer image of a younger self.
Yeah.
Obviously with a lot of edits. Of course, she looked Caucasian on that picture and she just didn't look human. It looked anime generated and she wanted to look like that. So
you said no?
Of course I said no. So the skin was porcelain white on the image and I told her, I don't think, I said I can help you look better, but I don't think we can go quite near what you are showing me.
And was she okay with that?
Well, we had a long conversation because this lady obviously had some body image issues.
Yeah.
In the end, I remember I ended up not even doing any treatment for her. Because we couldn't give her the expectations that she wanted.
Yes. And I've been walking with you for quite some time, and I know that you love natural looking results. Right? So that was obviously not something you could do, something that was so unrealistic.
Correct. You know, if we go down this slippery slope, then we end up making someone looking weirder and weirder. Yeah. So we try to avoid that, and it can be difficult, but a lot of education is needed to tell patients that this is not the way to go.
So I just found out that there is a story of yours with a patient, and this is one of the most unforgettable experiences you've ever had in your entire career. Can you tell me about this?
Well, okay, so from time to time we have patients who are not so easy to handle. They can get very angry, they can threaten to sue us. A lot of times it's because expectations are not met. So sometimes when patients get angry at us, I do step back and ask myself why. And a lot of times it may be because we didn't tell them and they didn't get the full idea of a treatment. For example, just yesterday, I had a patient who left a 1-star Google review on me and said that I spent $700 with Dr. Seo and now in 3 months, my frown lines are back. And this is unacceptable to me. So we tried to explain to her, we did explain to her, well, she has a huge frown line. And we, of course, put in a bit of Botox so as to weaken the muscle here. Yeah. Well, I explained to her that this will last 3 months and you have to come back every 3 months because it's so deep. But on top of that, because there's already a line, I need to put in a bit of filler. Yeah. And I charged her actually less than half price at $400. So as just to plump up the line a bit. So I told her the filler can be done once, whereas you have to continue the Botox treatment every 3 months. Otherwise, it will come back, which is exactly what happened. So she flew off the rails and got very angry. So very often it is expectations, right? So she thinks that, I paid $700 is a lot of money and it should last me a year. But it only lasts 3 months. And if you look at any literature, that's how long Botox lasts. So it's all about expectations. We tried our best to explain to them, but they just don't listen. So as for my most unforgettable experience, I once had a mother and a son who came in for acne. And then the son had acne. And they're actually a lovely mother and son pair. But the problem is that with acne, there are many factors and it takes multiple sessions to treat. And a lot of your lifestyle factors really interfere and really determine whether the treatments work. So unfortunately for this patient, after a few treatments, the acne was up and down, didn't get better. And the mother got very angry and she often barged into the clinic and asked demanded to see. She wanted me on the phone, and she threatened to sue because the acne was not getting better. So in the end, I really had to sit them down and just explain to them, offer them a refund and say, look, I think we need to terminate this doctor-patient relationship because really it's not working out, because the expectations are not meeting what I can deliver as a doctor. I am not God, so I have my limitations and I cannot deliver what you want. So so things like that do happen.
Oh my goodness. And they took the money, the refund, and they left. That was the end of
That was the end. So sometimes it's a happy ending for everyone, because then at least we all have a good resolution to it. But these things can really escalate. So you hear of all these complaints to the medical council, and sometimes it goes into the press, but really a lot of times, right, it's really not the fault of the doctor. It's really because the people are angry, the patients are being very angry, and there's just a lot of miscommunication. Sometimes we try our best, but people are just not listening. Then because it can be so difficult, and plus there's a lot of online chatter, a lot of social media, friends may be telling you things, and therefore it all clouds people's judgment, where it really can be resolved with just proper sitting down and talking to each other.
I think it's also because, like what you say, they think you're God in a sense, where you can create miracles when it comes to the physical appearance. They want something done. They have this image in their head. Maybe they they generate some AI photo, and they're like, as long as I have you, Dr. Siu, you will make this happen.
Not only that, it's also social media. So now there are many social media platforms which are not telling the truths. So trends that you can see, you can see these plastic surgeons going on social media, on Instagram, and saying that I'm a plastic surgeon for 20 years. I'll tell you that rubbing papaya milk will make your breasts go bigger. So, these are really just for generating leads,
Right.
And when people hear these, they begin to have very unrealistic and false expectations. And that's how all these problems happen.
So I've got a controversial topic for you. Do you think that there are some doctors out there who prioritize profits over the well-being of their patients?
Wow, this is a controversial and sensitive topic, right?
Yeah.
Unfortunately, I will have to say yes. There are some businesses and clinics that do that. So most of us, when we come out to do aesthetic medicine, we are still primarily doctors at heart, and we really want to do the best for our patients. But more and more, clinics are now run by businesses, and really the bottom line, profit margins, play a big role in what they do. So in these clinics, a lot of times they are trying to prioritize profit over treatments and outcomes. There are also some, for example, businessmen-run clinics that sometimes they cannot secure a strong doctor, and what they have to do in return is to drop the prices. So they drop the prices, and when they do this, the only way to make back what they've lost is to, of course, do it in volume. So there's a lot of hard selling, there's a lot of giving patients what they do not need, and very often the people who are really at the losing end are not only at the patients, because then you get sold a lot of things you don't need, and it may even end up in complications, but also the doctors who are made to perform these treatments that are against their ethics and morals. There are some countries which are run very differently from Singapore.
Okay.
So in Singapore, most of the time it is the doctors who tell the patients what we need. But in some countries, you'll be surprised, it is the sales consultants who really run the show. For example, in some countries, you will first see the sales consultant who will tell you that you need 10 fillers, 20 fillers. And then after that, they'll tell the doctor to do these fillers, and the doctor just have to find a way to inject them. And this is where a lot of problems and complications happen, because then, of course, the patients end up looking overfilled, or worse, they can get a catastrophic complication such as injection into an artery, resulting in blindness.
So these sales consultants don't have any experience. They're not doctors.
They're not.
They're just there to earn money.
Well, they of course they have some training. They
Right.
probably have some day-to-day training and on-the-job training on the treatments itself, but they are not the ones who have gone through 6 years of medical school. And of course, for them, the priority is their commission.
Yeah.
Fortunately, this does not happen so often in Singapore, but it's really a common phenomenon in other countries.
I guess the most important thing that viewers would want to know is, how do we, if we're visiting a clinic for the first time and meeting an aesthetic doctor for the first time, how do we tell that this doctor is someone that prioritizes profits over our well-being? Like, are there any telltale signs?
I think one good way is from word of mouth, right? If your friends had a good experience with the doctor, then you can be more reassured.
Yeah.
The second thing is, of course, if you notice that the doctor is keep trying to tell you and sell you things that you think you don't need, or to even tell you to do too many lasers, for example, or too many of the treatments. So in general, we will never tell patients to do 20 or 100 treatments at a time, but this happens in some clinics. So that's, of course, a very telltale sign. And if you're ushered out of the consultation room into a little booth with a sales consultant who keeps trying to push more and more, then that's, of course, something that should ring some alarm bells.
Okay. I think you raised a very good point about word of mouth, because that is how I discovered Dr. Sue. So actually, it was many years ago. It was a campaign that I was invited to work on. And they told me you can have your pick of any aesthetic clinic in Singapore as long as they offer out therapy services, treatments. And I didn't know anything about aesthetic doctors or treatments or clinics. So I asked a doctor friend of mine, I said, hey, of all the aesthetic doctors in Singapore, which one is the best? And I don't just want your opinion. I want you to ask your doctor friends as well. So he went off, he asked all his doctor friends, and he came back and he said, Dr. Sue at Radium Med. I'm like, I don't know anything, but I'm going to go with this one.
Thank you. Thank you
so
very
Dr.
much.
Sue is not just recommended by friends, by good online reviews. He's recommended by all the doctors, not all, but a lot of doctors in Singapore. So what are you waiting for?
No, I do a lot of do a lot of teaching, mentoring, and I give a lot of talks. So one of my passions is, of course, sharing.
Yes.
So I share via conferences, even my online platforms, social media, and that's how I get to know a lot of my peers. So I'm very grateful for their kind words.
Yeah, and Dr. Sue is almost never in Singapore. He's very busy because he's always flying all over the world to give talks. So if you want to see him, and you should just hurry and get an appointment right now. Then you can wait 2 months to see him. I have a friend that visited someone who was performing home-based aesthetic treatments. She got it done, and I was wondering what your take is on that. Should we be visiting all these places because it's so much cheaper? I think she mentioned it was $250 for everything that she got done. And I was so scared because I told her, just go to Dr. Sue, just go to Radium, you don't have to be worried. But for example, if I decided to shadow you and see how you do your treatments, could I then open my own home-based business?
Well, of course, the short answer is, of course, no. So in Singapore, only medical doctors are allowed to perform treatments. This includes all energy-based devices such as lasers, radio frequency, high-intensity focused ultrasound, and all injectable treatments. So if it is a home-based treatment, definitely a no-no. There are some big risks when you have it done in a home-based environment, of course. The person who is doing it may not be properly trained and catastrophic problems can occur. Of course, the area may not be sterile and you may be injecting and causing some introduction of bacteria infection down the road. Well, in Singapore, it's very strict. Only doctors can perform most medical treatments. In other countries, it may not be so. For example, in countries like Australia, a registered nurse can perform injectable treatments. So I think the most important is to go to a healthcare professional who has been properly trained. So interestingly, I do have patients who have gone to home-based treatments. So some of them will sheepishly tell me, they try to not tell me everything, but I sort of can tell that they have gone to somewhere that is not legalized. So the problems I've seen from these treatments, of course, sometimes it doesn't work. They have machines, they have lasers, but the lasers are obviously substandard. They do not come from a reputable source. Our joke is that this is a Pico laser of unknown origin, PUO. And then I have had those I've had patients who have had filler done in a home-based environment. So fortunately, those I have seen did not have severe complications, but then it comes out looking lumpy and not so nice. So I had to dissolve the fillers for them. And I have another interesting thing to tell you. Some of these home-based treatments are actually not cheap. They're maybe 20 to 30% cheaper than what we charge in the clinic. And so I really have to tell them and everyone out there that it's not worth it.
Yeah.
So please, don't save that little bit of money. please come to a reputable clinic to get your treatments done.
Yeah. So like what you mentioned, like some people come to you after getting a home-based treatment. They say it's lumpy, the fillers or whatever. They get it dissolved. So the friend that I mentioned, I think she paid like $250 to get fillers done on the cheek and some Botox. But after a while, she realized that she didn't like the fillers because I think it was too much. So she went back within a week and she had it dissolved. So it's not just, risking the lumpiness or having something go wrong, but you're also risking someone who's not an expert in judging how much needs to be put in. Because for you, you like natural results, and everything you've done for me is not a drastic change, but it does enhance what I'm already working with. And I think for my friend, it was more of, I just want fillers, and then they just put it in, and she didn't like the results. She didn't know what to expect. And there you have it. She wasted her time, she wasted her money, and in the end, nothing changed for her.
Yeah, precisely. So that's a really very real and very common story. Yeah. So, your friend went back to her to get dissolved, but a lot of them come to me and other doctors to get dissolved. So you're right, it's a waste of time, money, and of course, it can be dangerous as well. So why not just get it done right the first time?
Exactly. In the end, you save money. It's girl math. I feel like a lot of conversation online or with friends has been about women who opt for aesthetic treatments. But I feel like the conversation has sort of shifted nowadays. A lot of men are now opting for aesthetic treatments. So what are some of the treatments that men are going for nowadays?
So for men, generally, they always want to look fresher. There are two kinds of male patients who come to my clinic. The first kind will come in by themselves and say that I want to look fresher. And this makes up maybe 20 to 30% of my male patients. And 70% of my male patients come in dragged by their wife. And the wife will come in and say, my husband is looking very tired, and I want to make him look fresher. So generally, men, we don't want to erase all wrinkles. We don't want to make them look perfect. Yeah. We just want to turn back the clock a bit for them, so that we look fresher and younger. Men don't want to come back too often. So it's often more one-time treatments or treatments that do not require them to keep coming back. So in my practice, the treatment I do the most for men would be our therapy. This is microfocus ultrasound with visualization using ultrasound energy to lift the skin and to tighten.
I found out that there's Out Therapy Plus now. Is there?
Oh yeah, so there's Our Therapy Prime.
Prime.
This is the new. This is the latest version of Our Therapy, and what it is it's an upgraded version over the old machine. So it's basically faster. We can now see better on the screen, bigger screen, more precise visualization. This means that we can deliver a more precise treatment.
Okay, and there you have it. If you're a male and looking to look fresher, or if you're married to a male and you want him to look fresher, look for Dr. Siu.
So there are other things we do for men, of course, injectables. So you'd be surprised that men, they would rather want something that they can do one time rather than to come back many times. So when I tell them about injectables, they're usually quite open to it. So as we grow older, if we lose volume, we need to replace it. So I do a lot of biostimulation, filler injections for men so that they can replace the volume they have lost. And with nowadays, a lot of these treatments, they not only give you volume, they also can tighten skin. So these are the treatments that I usually recommend for men. And then you only have to come back once every 2 years or so.
Oh, wow, that's amazing. So you see your male patients about once every 2 years. How about your female patients? How often do you see them?
Well, it really depends on the problem. Okay. So again, a lot of my patients who come for, say, some skin sagging, they want some tightening, I see them maybe every 6 months to a year. But now, the thing is all about skin quality now. And if we want to boost our skin quality, we need to maintain it. These patients, I need to see them every 3 to 6 months. But there are also conditions such as melasma. This is the form of very stubborn pigmentation. Right. So these patients, if I want to do any treatment for them, I have to see them very often, even as often as weekly.
I mean, I'm Dr. Siu's patient. I would see him every week just because he's so cute. So I realized that there are a lot of clinics who advertise very low prices for their treatments. And I was wondering, how low can these prices go? And would they be harmful if we were to opt for a much cheaper package or a treatment at these kind of places?
The short answer is there's never how low it can go other than zero. So I think the problem now that we're facing in the industry is that prices are dropping lower and lower. To give you an idea, a laser typically cost $500 maybe 15 years ago. Right now, people are advertising it at $28. So how can this happen? Because we know how much a laser costs. We know how much rent and manpower costs, right? So the only way to do this is two ways. Number one, the price is not true. So if you see something that is really low price, it means that when you go in, they'll probably have to tell you to top up in order to have the full treatment done.
All the hidden costs.
Yeah, so all the hidden costs. Right? So it's again advertising that's not real. And unfortunately, this is harming the industry because then people get the impression that, hey, I can get a laser at $28, which is really not possible. The second way they can do this is, of course, to hard sell, right? In order to sell you lasers that are so cheap, they will have to make you buy big packages. They may be using this advertised laser as a loss leader. So you go in, maybe they make a loss on this, but they will have to make back that profit in some other way. And the only way to do this is to sell you a lot of other treatments or sell you huge packages.
So you go in for laser, but then you get pressured to go for Botox, for fillers, for everything else that you don't want.
Precisely, are things that you probably don't need. And that's the only way. I mean, this is simple economics, you know. Yeah. We're not trying to speak bad about other people, but this is just how the way the world works. Because in Singapore, for example, it is such the costs are just so high, you know. It's so hard to make ends meet.
So let's talk about fillers. So you recently did some on me. I have some under eye and I think maybe a little bit of chin from 2 years ago. But is it possible for people to get too much fillers? Is there such a thing as too much?
Well, fillers have been shown to be really safe. So if you're talking about safety and overdosing, there's really it's really very, very safe. And if you look at the filler box, right, HSA actually has a warning to say you shouldn't exceed how much. But even if we go beyond that, it has been proven to be medically very, very safe. However, let's say with biostimulatory fillers such as PCL and calcium hydroxyapatite, we want to be careful. If you put too much, you can cause problems like lumpiness or even an immune reaction known as granulomatous reactions. And these can be problematic and they can cause disfigurement even. So with fillers, the most common complication of having too much, of course, is looking too puffy and being overfilled.
Pillow face.
Yes, pillow face. It's not only pillow. You know, you can have avatar nose, you can have witch's chin. You just look very unnatural. So this is really a build-up. So the problem is when doctors inject either too much at one shot or they inject too much over a period of time. And this can look to an unnatural outcome and appearance.
So have you ever gotten a patient who's come in with too much on the face and you've had to advise them to dissolve?
All the time. So a lot of patients follow me through the years, over 10 to 15 years. And of course, they come back yearly still and ask me to put more. But I will have to advise them, no, the fillers are still there. Like what you mentioned about your chin, we put that in over 3 years ago and it's really still there. We really don't need more.
You can tell?
Yeah, we can tell because the facial proportions are still balanced, right? So we don't need so much. But a lot of times when patients doctor hop, they go from clinic to clinic, this is when we don't know. And this is when a lot of times the overfilling can happen.
Right.
So when these patients come and I look at them and they don't look too natural, then I have to really advise them that we shouldn't put any more. And in fact, we should go down the road of either waiting it out or really dissolving them. So the good thing is now I have an ultrasound in my clinic. And I can ultrasound and really tell them, look, under your skin, there's still some fillers and please do not put any more.
Oh, that's so clever. Do you think people used to doctor hop in the past? Because let's say someone came to you and they wanted more fillers, but you would refuse because you've already done them. So they would just go to another doctor to get it done because they wouldn't know that they have it already.
So yes, so doctor hopping happens a lot in aesthetics. So it's like what you said, right? It could be because the first doctor is trying to be good and not wanting to put. Then they end up with another doctor. The second reason could be price, right? So a lot of times people are price sensitive and when they see that this place is cheaper, they just go to another clinic. The third thing is recommendation. So maybe they hear from friends that this is good or they read online that this is good. So they hop another doctor as well. So this is unfortunately the nature of aesthetics. A lot of people, Dr. Hop, and this is how we get problems such as overfilling. And the other one we're getting, of course, is also toxin resistance. When people get too much Botox injected. And when you inject too much Botox, too short a time, too high doses, what we can get is we can get a body buildup, antibodies to the toxin, and therefore the toxins work less and less. So this is known as secondary failure or Botox resistance.
Oh my goodness. So it is really, really important to find a doctor who doesn't prioritize profits over the well-being of a patient, because they need to be able to look at you and say, hey, you have had too much, or you've had too recent. Because I think doctors out there, if they do prioritize profits, they would just say yes.
So yes, like I mentioned before, a lot of times, us doctors, we always want to be ethical, but a lot of times if the profit is really sales-driven, sometimes no choice because it is a business decision, then they're compelled to do that. And then they just put in more and more, and this can do more harm than good.
Oh my goodness. And speaking of fillers, we've been talking a lot about facial fillers. But I recently come to learn that there are fillers for other parts of the body. So asking for a friend, what is penis filler and how does it work? Does it really work? How much longer can it get? Just stop me. Dr. Cyril, it's a bit too big now.
So this is trending, right? I see it a lot on Instagram now. People are talking about penile enlargement with fillers. So as you can think about it logically, right? Penile fillers really enhance the girth, but it does very little for the length. Because
if you inject it at the top, then
you can't inject filler on the glands of the penis, right? That would be really painful, and of course it will cause a lot of problems. So the only place that you can put penile fillers would be into the skin. So when you put it into the skin, yes, you can make the skin thicker, especially when flaccid. So it will look thicker and more masculine when flaccid. But when it's erect, I think it does very little to change that. You need tons of fillers. So we're talking about 10 mils to 15 mils in order to make any visible difference.
Yeah, because you have to go around the entire thing, right?
Correct. So I have to state that this is, of course, not approved by any authority out there, and this is off-label. And there are techniques to do it, but there are also complications. So if you ask plastic surgeons, they usually advise against it. And I myself, I don't perform this procedure. I have had some complications referred to me from other doctors after penile filler and penile filler procedures. So in some cases, there again could be unevenness. So you have to really massage it down, or we have to dissolve the lumpiness.
I'm sorry, you've had to massage a penis to dissolve the filler?
I had to do it. I cannot leave it to my nurse, right? So I had to do it myself. Unfortunately, it is a very uncomfortable and not happy experience for both doctor and patient, unfortunately. And the other complications that can happen is that they can really go in places that you don't want. So in some instances, we had fillers that actually leak out. Leak out because tracks have been...
Leak out of where?
Leak out of any the path of least resistance. So this could be anywhere from the head or around the glands of the penis, and this again is unpleasant, and we just have to really apply a lot of compression to the penile area.
I see. So massaging and compression.
Compression until it heals, or we just again have to dissolve the filler.
Very interesting topic. So now that we're done talking about the penis, hopefully, let's move on to the vagina. I've also learned that there is vaginal fillers. How does that work? Asking not for myself, for sure, because I think I'm a bit too young for that.
So I'm a bit more positive about vaginal fillers and rejuvenation. Again, I do not do it, and this is of course not. It is off-label,
but your clinic does that.
Well, some not the fillers itself, but some of the rejuvenation. So let's talk about that in a while. So vaginal fillers, of course, is to plump up the areas that have deflated with age. So that can happen with age, of course. And it happens a lot, especially when you get to your perimenopausal years. And we put fillers into the labial area, and this makes it look a lot more plump and a lot more visually and aesthetically better looking. But what I really believe is that plumping up is not enough. what we really need to do is to regenerate the area. And there are substances that can do this. So biostimulatory fillers, for example, calcium hydroxyapatite, can not only plump up the filler, but to give skin tightening. And that makes the labia and the genital area look a lot better. The second one, which I'm really more positive about, is using polynucleotides. So this is fish DNA. And when injected into the area, there are products that are specially made, polynucleotide products that are specially made for the genital area for the female. When injected into the area, again, it tightens skin, plumps it up a little, and most importantly, it really heals the micro tears that happen in the vagina opening, the entrance of the vagina with menopause. And this actually improves the quality of life to those who are affected. So this is something that I think that it's really very useful, and it's really something that we need to think about.
Stupid question, but you mentioned fish DNA. Does it then, if I were to opt for this, will it make it fishy down there?
No. So when we talk about fishy down there, it's usually an infection, for example, from candida or yeast, right?
Yeah.
So fish DNA or polynucleotides is really this treatment that is regenerative. We take the fish, the DNA of the fish, we splice it up, and the DNA fragments actually stimulate collagen and regenerate the skin. So it's not only done for the genital area, of course. Most of the time we do it for the face, for the neck, for the hands, for the chest, anywhere on the body. It really helps to make the skin younger.
People are putting fish DNA into their bodies? So let's talk about personalized aesthetic treatments like genomics and epigenetics. Is it something that's really helpful, or do you think it's just a marketing gimmick?
Well, it's important to have everything personalized to your needs, especially now because we want natural regenerative results. So this is one big thing that we're advocating in 2025. And to help us, what we have engaged is, of course, a very detailed examination. We really have very high-tech imaging these days so that we can see what's under the skin. And the other thing that I find very useful in my practice is really, like what you said, genetics and epigenetic testing. So to give you an idea of what it is, genetic testing really is to look at the genetic makeup of what we are and then to see what we may be prone to. So by doing that, we can actually have a clue of what may happen right now in our lives or later in life. Epigenetics, on the other hand, is really what our genes are expressing right now due to our environment and our lifestyle habits. So that's even more important because it tells us that at this point in time, what our bodies are doing and responding. So that will really help us and guide our treatments. So to give you an example, through genetic testing, we could perhaps see that, our skin is very prone to wrinkles and dryness and pigmentation. And therefore, then we can advise our patients to really start young and really use sunblock, a lot of sunblock, avoid the sun. Please do not go tanning, do not do so much sun exposure. And with the epigenetics, perhaps we can see that, right now the skin is really in a state where there's a lot of pigmentation. And from there, again, then we can say, okay, so right now we really have to step up on our sun care, skin care, and we also need to do treatments for pigmentation. But I think it goes beyond just aesthetics. When we talk about epigenetic and genetic testing, we really can look deeper into our health. And this really impacts our quality of life and longevity. We can have an idea of how our heart is, our heart health, our brain health, even our psychological and our emotional health, because these actually can tell us whether we are prone to things like anxiety, to depression, prone to heart attacks and strokes. And this will allow us to really make better choices, lifestyle choices earlier in life, so that we have a better quality of life later on in our elderly years.
So basically what you're saying is that with genetic testing, it's really all about prevention better than cure. We go in and we fix all these before they even become problems. Rather than coming in saying, I have wrinkles, I have all these dark spots. We don't even give them a chance to form, to happen. We go in before that.
Absolutely. So by looking at our genetic makeup, it will give us a better idea of what we are more susceptible to. So like you said, it can be wrinkles, it really can be pigmentation forming, or it could be something more serious like, for example, prone to muscle wasting, right? So we have to do more exercise in order to prevent that.
So what are you waiting for? You spend a little bit more money now, get it personalized, and you save a lot more money in the long run, right?
Correct, yes. So we're really at the infancy stage of these personalized treatments, and I think there's a long way for us to go. Genetic testing, epigenetic testing, we're just scratching the surface. So right now, I'm really into more of a holistic approach. So we treat the whole body, mind, body, and soul, rather than just the skin.
So this is something that you offer at Radium Med.
So I offer this more at my Malaysian practice, Aura Regenerative Wellness Clinic.
Congratulations.
Thank you. So over there, we really do the personalized genetic testing, and we have the whole holistic suite of services, from biohacking such as cryotherapy to infrared saunas to vibroacoustic therapy to calm your soul, to calm your mind, all the way to aesthetic treatments. And we're talking about a lot of cellular therapy and really personalized treatments so that we can treat all aspects of your body, not only looking at your skin, but really to make you younger and feel better from inside out.
Oh my goodness, it's perfect because I do have a trip to KL, so I will see you then.
Please come.
Okay, so here's something that I want to know. Are there any aesthetic treatments that I can get that will be covered by insurance?
Well, so in Singapore right now, no. So aesthetic treatments are not covered by insurance. And if you ask me, I think that maybe strictly cosmetic treatments should not be covered because this is really just for our appearance,
vanity.
Right. But I think that there is a gray area that we should really look into. So for example, there are some aesthetic treatments that are also medical. For example, acne, right? If we do not treat acne, really it can cause scarring down the road, right? Or even acne scarring. This is disfiguring and can impact the emotional status of someone. Mm-hmm. And the other thing is, of course, teeth grinding, which you and I both have.
Yes.
So teeth grinding is a medical condition, bruxism, that causes us to grind subconsciously at night, and it can crack our teeth. And my mother, she has lost all her teeth at her age of 70 because of grinding. So these are serious medical conditions that we can treat with aesthetic treatments. So with bruxism, we use botulinum toxin to treat. Mm-hmm. And I think that this should be one day covered by insurance because there is a medical benefit to it.
Yes, I agree. And because my nocturnal grinding is so bad, I have friends who tell me like, hey, why do you even opt for Botox? Just get retainers, night guard. Mm-hmm. But to me, that's not curing the problem. That's just a temporary solution because I still grind, and the muscles were so developed. Like you told me, it was abnormally large.
Precisely. So for bruxism, for example, we can use a guard and it will prevent our teeth from wearing down, but then it will still not help the headaches, the neck aches, and very often the night guard sometimes can impact how we sleep. So I had a guard for some time and I couldn't fall asleep. And that's why I had to opt for toxins to reduce the strength of the muscles to stop the nocturnal grinding. I myself, I've had 2 cracked teeth, and it's really very catastrophic if I don't get my treatments done.
So at this point, none of these treatments are covered by insurance, but you're saying that it should probably and hopefully in the future?
Precisely. So now they are not covered, and hopefully we can start to have this conversation in the near future with the authorities such that they can be covered to some extent by insurance.
Then the next Meet the People session, we will bring that up. So what are the latest aesthetic trends that we should be keeping our eye on?
So on social media, you'll see trends come and go all the time. The one I see a lot is now plunging your face in the morning into a bowl of ice. So this is supposed to make you wake up and look better and keep your skin young. So there's some truth in it. Well, cryotherapy or cold therapy can really tighten the skin and really have some anti-aging effects, but just putting it into ice like that is just not enough. It's too short. You need to at least immerse your whole skin in for 3 minutes. And I actually prefer cryotherapy, where you immerse yourself in a whole full cryotherapy chamber for 3 minutes. That has true anti-aging effects.
That sounds a bit more painful. Any other trends I can explore?
So what right now, 2025, the trend that we keep talking about at conferences and all the thought leaders are talking about is really regeneration, and natural outcomes. So we want the skin to be really in a really state of being young rather than to look unnatural, overfilled. And there are many ways to go about this. We have to pick treatments that are not causing scarring in the skin. We have to pick treatments that we are not overdoing. Mm-hmm. And we cannot overdo lasers that are too often. For example, if you do pico lasers too often, it can result in the skin becoming patchy, and this is something we do not want. So one of the trends that have been really very, very viral in the past year or even a few years is glass skin, right?
The Korean glass skin.
Yes, everybody's talking about having shiny, reflective Korean glass skin. So personally, I really do not like that. And I think that it's really time to ditch the glass skin trend, because glass skin has this connotation of being reflective, transparent, and that's not natural. What we want to advocate is really baby skin. When we talk about baby skin, we're thinking about skin that is soft and plump and yet firm. So think about when we were born, when we came out and born as a baby, our skin was untouched by any environmental damage, right? It was in the best state that it could be. And yet, it is not trying to achieve something that we are not. So we are trying to turn back the time for us to be the best version of ourselves. And what better time it is, right? Rather than baby skin, right? So that was a time where our skin had no pigmentation, no wrinkles, you can never see any pores, and of course it was firm and bouncy. And there are many ways to achieve this. You may think it's difficult, but it's not. Glass skin is difficult to achieve, because with glass skin, you really need constant upkeep. You need tons of treatments. You need very frequent skin boosters, injections, and a lot of skincare, and of course, a lot of makeup. But with baby skin, we are advocating no makeup, of course, minimal makeup, back to embracing who you really are. And regenerative treatments lead the way. So we can do lasers, of course, but not too often, and the right lasers. We can do regenerative treatments, some biostimulators like calcium hydroxyapatite, like fish DNA, yeah, right? One of my favorite treatments. These are things that can really help to turn your skin back. And of course, very importantly, the right skincare. So we're talking about, of course, avoiding the sun, protecting your skin not only from UV rays, but also environmental damage. Yeah. And all these come together in a way that can be maintained. Okay. So we're talking about just doing treatments every 3 months or 6 months, rather than doing it every week, like what you need to do with glass skin.
Yeah.
And this, then, I think should be the way that we should strive towards in 2025, to achieve bare and very healthy skin, rather than unnatural looking shiny glass skin.
No, oh my gosh, I love this trend. It is low maintenance, especially compared to what you said, once a week for glass skin. Who has that kind of time or money? No, so yeah, baby skin, that sounds like something that I want to have. So I will see you in your clinic very, very soon for that.
Please come. I'll see you soon.
And that's all for today's episode. A huge shout out to Dr. Siu for joining us today and sharing his valuable knowledge and experience. And if you like what you saw, if you like what you heard, don't forget to like, share, subscribe, all the other stuff. Let us know what you want to hear us talking about next, and we'll see you for the next episode. Bye.
Bye-bye.